Good afternoon, everyone, and welcome to our Wednesday, February the 5th, 4 p.m. Special council session. I will now call the meeting to order. And item 1.1 is the territorial acknowledgement. We acknowledge that we are in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. Administrative and procedural issues. 2.1, approval of the agenda. I would ask for a motion from council that the agenda as presented be approved. Moved by Councillor Strong, seconded by Councillor McCormick. All those in favor signify by saying aye.
Aye.
Motion carried. Thank you very much. 2.2, today's agenda will consist of presentations from a number of people and organizations. I must say, welcome to everyone, and looking forward to your presentations this afternoon and having some good conversations surrounding your asks and your needs and what's going on in our community. And we certainly, as a council and group, we look forward to today's agenda, and it's great to have you all here. So, first up is our MP, Dr. Stephen Ells. If you could come down front and take a seat, and we'll get your microphone turned on there. There we go. You got the red light. You're good to go. And before we start, I'd like to say welcome and thank you for coming today. It's great to have you here, and we hope to have some good conversations this afternoon over the next little bit, and also to establish a schedule where we could meet with you regularly on a go-forward basis over the next 4 years. So thank you very much, and welcome, Dr. Ells.
Thank you very much, Mayor, and thank you to everyone for having me here today. People may think I'm here under the presumption we're going to form the next government. That's not the purpose of this, but certainly I think it's long overdue to have meetings with all the councils that fall inside the federal region of Cumberland-Colchester. And certainly perhaps a few of the things I'd like to cover today is some of the objectives if we are able to form government. I think that everybody around this council chamber knows that the thing on the minds of all of those that we serve is cost of living. And that is certainly the top three things that we hear in our office is cost of living, and cost of living. And those are things that we aim to change. Clearly, we know from things you've heard from my party for a long time is related to the carbon tax, and certainly that's something that we will remove. People always ask if we're serious about that. The answer is yes, we're very serious about that. And I want to make it clear, when I travel around, whether it's Cumberland or Colchester, I hear from the farmers first and foremost that they say, make no mistake, that the carbon tax adds significant cost to those who are out there milking the cows and growing the food for all of us. And of course, as all of you know, if you tax the farmer and you tax the trucker, then those of us who end up buying that product are the ones who pay more for it in the end. So that's one of the highlights, certainly we know. We also know clearly that we need to get the economy running again on all hopefully it's 12 cylinders. We need to get that. That's for those old people here, including myself, that we need to get this country and this province moving. I had the great opportunity to be at the Nova Scotia Forestry AGM this past couple of days. I guess it's Wednesday today, and the opportunity to see the innovation that's happening there, especially things that are incredibly important here to Cumberland County with low-grade fiber products and what we can do with those, the innovation that's happening. And I think that those innovative uses of low-grade fiber are things that are going to be especially important as we go forward, especially since we don't have a kraft mill in Nova Scotia at the current time. So finding markets for low-grade fiber and looking at other innovative ways to move the forestry sector forward, again, it's going to be a big mover for Cumberland County in general. People often ask about the budget and what we're going to do about that. As all of you know, we're $1.3 trillion in debt. The cost to service the debt on a federal basis is more than $1 billion a week, which adds up to almost exactly the same amount of money as the Canada Health Transfer. That is an untenable position. We all know that. If you ran your municipality like this, which I know you're not allowed, but if you tried to, you would be out of business very quickly. If you ran your own life like that, you would be. So fiscal accountability is incredibly important, and those are things that we will have what we call a dollar for dollar rule. So anybody who's in charge of a portfolio, if you want to spend $1, then you have to find that savings of $1 within your portfolio, as an example. So those things will become incredibly important to Canadians as we go forward. Two other things, excuse me, that I'll touch upon. One being housing. And we all know that federal governments do not build houses. That's just doesn't happen that way. Municipalities could build houses, but generally speaking do not, but you do permit houses. And one of the things that we would do is incentivize municipalities to issue more permits, such that you would receive more federal support if you issue more permits over and above that which you normally would. We will also sell off federal lands and buildings, and of course that doesn't specifically affect the municipality of Cumberland, but certainly with the armories in Amherst, that's an issue, and the RCMP former communications center in Truro, also an issue there. So improving that situation and looking at the holdings that the federal government has that it doesn't need, then we need to rectify that situation. Finally, one of the things that I've heard loud and clear across the entire country is related to crime. And we all know that crime is on the rise. I spoke with the chief in Amherst this morning. I've had multiple conversations with the RCMP and the chief in Truro. Crime, sadly, is on the rise. There's a multitude of reasons for it, but reforming the Criminal Justice Act is going to be incredibly important. We know that, and both chiefs sadly have confirmed this, that there are multiple people out there who continue to commit crimes over and over and over again, including those that are sadly violent crimes and are not serving that time in jail, and we aim to change that. So I think all of those things that are incredibly important. They're things that I believe resonate with the residents of Cumberland County as well. And certainly I'll stop there. As you know, I'm a politician. I probably could go on for a long, long time. But this is not a filibuster. It's a get to know you session, and I'm happy to take any questions that you may have. So thank you very much, Mayor.
Okay, thank you very much, Mr. Ellis. First things, I guess secondly, I should have probably gone around the horn. I'm not sure if you know all of our councilors, or new ones especially, or not. If we could start with Councilor McCormick over here, introduce yourself and the area you represent, perhaps would be some help. Let's go.
Councilor McCormick, District 5. So that is half of Spring Hill, all the way to Thompson Station, just outside of Oxford, and then almost to Collingwood.
Councilor Lockhart is available on screen here. Can you hear us, Scott? Go ahead.
Yes, I represent half of Spring Hill out towards Leamington, all the way out to Southbrook, and then through Rodney, and all the way out in Collingwood, out through Poison Lake area.
Councilor Lee.
Hi there, nice to meet you. So I'm District 7, so it's a little more rural. So you're looking at like Macan, River Hibbert, Joggins, down Shoreway, connecting with you, Westbrook Flats, those areas.
Councilor Strong, go ahead.
Thank you. Wonderful to see you and have you here. I am District 8, which used to be the old District 10, but now that Parsboro is no longer a town, I've had that incorporated to the district. So I go from Lower Five Islands all the way to Canaan Road and all of Advocate and all of the little communities in between. The largest district that we have.
Deputy Mayor Gould.
Yes, Fred Gould and Councilor in District 1. So we're responsible for keeping Amherst in bay. We completely surround Amherst area. So that's my area. I don't go out very far. It's pretty populated area. So I have probably the smallest geographic area, but heavily populated.
Anthony Fromm, District 2. I have the area of Tignish, Trumanville, Linden, all heading down towards Pugwash.
Councilor Hotelling.
Thank you. Thank you for coming. It's nice to see you again. I'm Jennifer Hotelling, Pugwash area out to Oxford and down the Gulf Shore Road and all of the Pugwash Junction.
Councilor Redmond is with us on Zoom too. Go ahead, Councilor Redmond.
I'm sorry that I missed you there, Stephen, but glad that you're thinking of doing this on a regular basis. It's nice to touch base. My name's Kathy Redmond. I look after Wallace, Malagash, Wentworth, Westchester, Sutherland's Lake area, and thank you for being here.
Thank you very much. I'll add to this to say that, you know, currently we're in the middle of our capital budget process and our operating budget process. And part of that is, you know, there's deliberations with council and looking at our current year priorities and our infrastructure stuff, we've got a number of ongoing things, and I note that, the federal process is more houses and, yes, municipalities, but that I would suspect that would lead to more infrastructure too, we hope, because we have a number in Cumberland County of large infrastructure needs right at the moment. And we're working on a new library facility in Parsboro. We're trying to find a solution to get some good drinking water for the village of River Hibbert and down in that part of the county. And still continuing a lot of work on our hub model for our fire departments and doing some family and youth engagement and trying at the end of all of that to maintain a reasonable tax rate. So, and with all our other ongoing responsibilities and the vast size of the municipality, obviously we're going to be in the next 4 years looking to you for whatever federal help we can. And, and it's interesting that you're here first and we're asking you, and then the next groups are going to be asking us. So it all runs downhill or uphill or sideways, and it's all intertwined at the end of the day. So, so one of the things we would ask for, as our MP is to be on the lookout for programs and opportunities, so that will help us orient the ship and sort of align and be in track with our council and their priorities, right? So anyway, so that will be the ask going forward. And like I said to you, prior to the meeting, no need to make notes. We'll get our written request and it'll be framed and ready for you tomorrow morning, quite likely. So, but now I'll open it up to members of council for a minute. If you like, has anybody got any questions or any comments or anything they'd like to ask Dr. Ellis? Kathy, Councilor Redmond, go ahead. Thank you very much.
I guess the first thing I'm going to touch on is aerial spraying. Is there anything in the works for banning, and I can never say the spray they use now, but we have a lot of woodlands that are being sprayed. And this is just wondering what's in the works federally to get rid of some of this aerial spraying. And you, being raised on a farm, I have a lot of side effects from the chemicals that I was around all the time as a farm girl. So it's kind of a concern for me.
Yeah, thanks very much for that. And certainly, as you know, I'm on the opposition side of the House right now, so they don't tell me a lot about what they have. What I would suggest to you, though, is it's incredibly important that Canada be a world leader in terms of safety, and I think that historically we've been able to accomplish that. I certainly want to take my hat off to the farmers and the farming community out there, knowing that they are continually working hard to reduce inputs onto their crops. Perhaps most likely driven by financial reasons, but that's doesn't really matter what the real drive is. I think the other important thing is I've certainly developed a close relationship with the DAL AC as well, and understanding how we can move forward with the newest technologies, often in, say, for our instance, our blueberry sector, using tiny cameras to identify in real time what the insulting problem is and how to treat it very, very quickly with smaller and smaller amounts. As I said, I've made a lot of inroads, I think, with our forestry community as well, and beginning to understand how important that is, but again, with that balance of health and safety. The other thing that I've been pursuing specifically is regulatory harmonization with other jurisdictions like the European Union. And I think that as we look around the world, that the European Union is often ahead of many other jurisdictions in terms of that regulatory harmonization. And I think it important that Canada, perhaps in light of the last couple of days, perhaps more important for Canada, to begin to align ourselves with other parts of the world to ensure that those standards are certainly things that we can replicate here in Canada, to say that we want to have trusted trading partners that we can use and rely on. I often look at it from a lens of healthcare to say, hey, you know what? If we were, Canada's a tiny healthcare market, it's about 2% of the global market. If we aligned ourselves with the European Union, for instance, then the likelihood of being part of a bigger global market gives us more buying power and more ability to have newer drugs to be introduced into the Canadian market. So for all of those reasons, I would suggest to you that European regulation harmonization is going to be incredibly important. And as I suggested, without stating the obvious, in light of the last couple of days, perhaps even more important for all of us to have those other markets available to us. Thank you.
Thank you. And if I just want to, it's the aerial spray that I'm deadly against. It's not so much the spray on the crops because that doesn't float around in the air and it doesn't dissipate the way that they say. Anyway, I thank you very much for answering my question.
Thank you.
Thank you, Councillor Redmond. Does anyone else have a question?
I have one.
Oh, Councillor Lockhart, go ahead.
Hi. Well, first, I want to thank you for taking the time to come today. And you and I have already had a few conversations on the drug crisis that we're facing in not just our communities, but across Canada. And I just want to say I was very uplifted by our talk that we had there a few weeks ago on this. And hopefully that, and I saw today actually a little bit on the news, your leader was talking about some pretty harsh penalties, which I totally agree with, for fentanyl trafficking and illegal drug trafficking, and also the need of treatment centers for people that are addicted, which is causing the uptick in crime and all these things. And the other thing was, we talked about this a bit too, was the tracking of opioids, prescription ones, even after they're given out, if they're taken back to the drugstore, what happens to them, or why some person's getting, a lot of these prescriptions filled over and over and over again. So anyway, just really looking forward to working with you in the future to hopefully we can try to work on solving a few of these issues.
Yeah, thanks very much. And in a nutshell, I think there's kind of three important parts to the treatment of the addiction crisis and epidemic that we have ongoing. Number one is, I think we've lost our focus around prevention. Oftentimes we're not talking to young people about, again, not to be oversimplistic, but just to be demonstrative, in the old Nancy Reagan days of just don't do it. And looking at those ways to prevent kids from going down that path first and foremost, which also folds into your comments around tracking opioids in the system from their creation to their distribution with the big national distributors, getting them out to pharmacies, and then going to that very granular level of tracking them when they're in the hands of actual patients, and where do they go from there, and making sure they're not falling into the wrong hands. The second part of that is, as I term, disruption. We still need to go after those people that are out there dealing drugs. And we know that, several grains of fentanyl is enough to kill somebody. So, what we talked about today in the press conference was 40 milligrams of fentanyl. People who are out there distributing that quantity are realistically, I don't mean to be overly hyperbolic or melodramatic, but those folks are mass murderers. When they know that 2 milligrams can kill you, if they have 40 milligrams, then that's enough to kill 20 people. That's a significant number of Canadians whose lives are at stake, and we need to have significant and harsh penalties for those folks. And then, of course, the final part of it is, and again, I know these are all gross generalizations, but in the interest of time, we need to have quality rehabilitation. Sadly, and again, this is not a unique situation to Nova Scotia, but we do not have rehabilitation beds, long-term rehabilitation beds, unless you're able to pay out of pocket in our province. And those are things that we would aim to change in working with trusted partners who would have proven programs in a pay-for-performance type of model of care, to say to those folks, you could open up more beds, potentially with funding from the federal government to help people get off these terrible, life-destroying addictive substances. So in a nutshell, that's kind of how we would look at addiction, and thanks for your question.
Thank you.
Councillor Lee, do you have something to say? Sure. Go ahead.
Thank you for that. Just one quick point to add to that. I agree. But I will add, I come from that world, I work in that world. I think it's important to remember addiction is an outcome, and sometimes getting ahead of it and having the mental health services available for these individuals prior, it certainly supports outcomes on the back end with the addiction issues and rehabilitation facilities needed. Mm-hmm. So to get upstream, I recommend a lot more supports ahead of time, not just the say no factor. I think there just needs to be a little bit more invested in the mental health services that people can get help before they end up in a predicament where that is an outcome. So.
Yeah, thanks very much for that. And as I said, you know, that wasn't the entirety
No,
of
I
the
know.
of the presentation. So that you know, I don't want you to take it as such. Certainly, you know, part of the difficulty with mental health services, as you well know, those services are delivered by the provincial government, and we need to have clear jurisdictional lines of communication and lines of responsibility in a federal government. The other part of that is directly related to what we've called our Blue Seal program, which would be recognizing the credentials and experience of folks trained in other jurisdictions, so that we would have them undertake a practice-ready assessment program so that they could, based on their skills, not based on their ability to write a test, that they could get to work very quickly here. That could easily apply to you know, physicians, psychologists, nurses, nurse practitioners, you name it, anybody in healthcare, that would be a program that would work very well for them. We also know that there are many Canadians who have studied abroad. And when you look at kind of a profession, again, I'll just break it down into something that sounds overly simplistic, but if a Canadian has studied abroad, they will already have language skills, they will have cultural skills because Canada is their home. What they need is their ability to either finish their professional training or prove their professional training. Obviously, bringing those Canadians who've studied abroad home makes great sense. The other difficulties we have in this country right now is everybody in the healthcare space wants to talk about the crisis that we have. The time for talk is over. These are real crises that we have. We have 6.5 million Canadians, for instance, who can't access a family doctor. We know in our own province there's over 100,000 or thereabouts. That means that for those folks, we don't just have a bad system, we have a non-existent system. And we can talk about Canadian healthcare. I mean, I worked in it for 26 years as a family doctor. We can talk about how great the system is, but for those folks, it is not just a bad system, it's non-existent. And if we don't begin to act like that's a crisis, then we'll continue to do the wrong thing. And that would be my goal if I ever have anything to say about it, which, you know, there's only one person who knows that if we form government, it's not me. But if I did have that opportunity, we need to stop talking about things and we need to get to work in this country to say this is a bad system and we need to use every tool that we have to change those things, including mental health. I agree with you wholeheartedly, but if we're going to say the word crisis, then we need to act like it is. So thank you for that.
Thank you very much. Does anyone else have any questions or comments? I'll round this off by saying I heard you mention the RCMP and whatever, and we certainly as a group and municipality would look forward to some increased assistance and funding from the RCMP. As you know, we've recently gone through a police review and most recently have gone back to 24/7 policing with the RCMP in the County of Cumberland, which is having, so far from what we're hearing and what we're seeing from the residents, a very positive effect. But then again, if you're going to get tough on crime, you need more help to get tough on crime. So we would welcome any advancement in that as a municipality for sure. So I'll close this by saying, do you want to make some comments on the Chignecto corridor and where we're going? I know you've been well versed on, been out at the dikes and looked around and saw the isthmus and everything else, and if you want to make some comments on that, that'd be great.
Sure. Thanks, Mayor. And you know, the isthmus, of course, is something that locally is near and dear to our hearts. Unfortunately, you know, much of the country and sadly much of our province want to talk about it as specifically an Amherst problem. Those of us who get to know the problem know that there's not an easy solution, and it's not specifically an Amherst problem. Obviously, if the isthmus is flooded, we're going to lose the rail, the highway, and the communications that exist within that. So, and that, of course, negatively affects all the movement from the Port of Halifax. And we now know that the port in Montreal is dredged to bedrock, so the big post-Panamax super tankers can't come into to Montreal. They're going to Halifax, and that presents incredible opportunities for everybody, you know, from all of our province, and it creates, of course, problems for Newfoundland as well. So we need to continue to find a solution for that and to say, how do we move forward? Actually, next week, I'm going to the Valley to talk to Tim Webster, who I'm sure you're well familiar with. And I think that it's important to ensure that we have the proper answer for this. I would suggest there are folks out there who say we might not have the answer for it. It's not an easy thing, and it's going to be, as you know, Mayor, incredibly expensive. And I will have the opportunity to speak to the Premier this weekend about that as well. So it's high on the radar screen. As I said, I bring ideas. I hope to bring operationalization, and of course, as the future unfolds, money as well. I know that's incredibly important.
It's, thank you very much. That's, it's all about the money for us, for sure. So I'm not going to hide behind anything else. It's all about the money. And on behalf of council, thank you so much for taking time out of your busy schedule to come and have a chat with us. And we'll send some information along to you in the morning, and looking forward to getting our regular schedule set up and getting to work on some projects. And we're looking forward to the role that you will bring to the table to help us. So once again, Dr. Ellis, thank you very much for coming today.
Thanks very much, Mayor, and thanks you to all the councillors. Appreciate you for having me. And look forward to the future. Thanks.
Thank you.
Okay, thank you very much. Item 2.2, Cumberland County Transportation Services. I will remind all of those that are present here today as presenters that we have, just so you know, we have an allotted time set aside at 15 minutes. Today, normally we would be running a council meeting for another period of time right after your presentations and whatever. I will allow you some leniency today. If your presentation goes over by a bit, we're okay with it, because we do not have anything else behind these presentations today, so anyway, go ahead, come to the front there and introduce yourselves, and away we go.
Yeah, thank you, Mayor and Council. My name's Peter Lewis. I'm the recently acquired title of Chair of the Cumberland County Transportation Services Society. I succeed Bruce Kuko, who's Chair for many, many years. Yes. And we want to thank you for allowing us to do a presentation here today. And we also want to thank the Council for supporting CCTS in the past. Hopefully, we'll continue the partnership in the future. To my right is Helen Sims, our Operations Manager Dispatcher, and she does the day-to-day stuff. We were consulting quite a bit on the presentation today, but since she does the legwork from day to day, we're an oversight board, and Helen does the operations. So I'm going to turn that presentation over to her. So there you go, Helen.
Okay. Thank you very much for having us today, and thank you for me not having to bring the laptop for the presentation. I think last time I did that, it didn't work properly anyway. So. Yeah, basically the process is today just to make you aware of what our services are. We've been around since 2009, but things have changed. They threw a pandemic in the middle of that, and then it was a little interesting for a while, but things have certainly got pretty busy since then. So basically we are accessible, affordable, not-for-profit public transportation. We service all the residents of Cumberland County. We're also, I say, a non-profit. We're registered with Joint Stocks. We're also a charity, so we're registered with the CRA as a charity. Basically, we were established 2009. The Healthy, I have to get these names right, Healthy Parsborough Area Community and the Amherst Area Transportation Service met back in, I think it was actually 2008.
Around then.
Yeah, Peter would know because he's been around since then. Yeah, he was there, been there, done that, yeah. To discuss the need for accessible transportation in Cumberland County. I say we basically got going in 2009. Currently we have 6 vehicles in our fleet. You probably see them around town quite a bit and around the county. We have 2 Dodge Caravans, 2 gas Dodge Caravans. There's one up on the top right with the ramp out. We've started switching over to hybrid vehicles 2 years ago, so we now have 4 of those, 2 with side ramps, and the one we purchased last year has a rear ramp, which enables us to take the bigger chairs and scooters in the back of the vehicle, as we don't have our bigger buses anymore. And we have a non-accessible hybrid vehicle that allows us to
you know, we use mostly for the longer distance trips where we don't need wheelchairs to go to Halifax and Truro and so on. Misconception is we don't actually run from 8 till 4. We have drivers on the road sometimes at 4 o'clock in the morning because the Halifax hospitals like getting people from Cumberland County there at 7 or 8 o'clock in the morning. They don't look at a map when they book the transportation. They say, oh, you can come down for 8 o'clock in the morning. So normally we have drivers on the road at 5:30 in the morning till 7, sometimes 8 o'clock at night. We run Monday to Saturdays and Sundays as required. We run on holidays for dialysis, wheelchair clients. Basically, the office is open 8 to 4, but we work from home, so we answer the phone from 7 till 5, 6. You know, the drivers just know not to call us before 6 in the morning because we're not very happy. We have 4 full-time drivers right now, 4 part-time drivers, and my fleet coordinator dispatcher is also able to drive as well. And like I said, we're on the roads nice and early. All our vehicles are inspected every 6 months. They have an MVI every 6 months. Once a year they have what they call brake measurements on the vehicles. They have winter study tires on them every fall, which comes in handy, especially like last week when you had all kinds of weather. Normally, when they cancel schools in Cumberland County, we don't run except for dialysis. Sometimes there are a few exceptions to that. Last week we had 3 snow days. We still did a couple of medical trips within Amherst that were fairly essential, like chemo and so on. And I say we do dialysis runs no matter what, whatever the weather, unless it is really, really, really bad or they close the marsh, because we go to Moncton 6 days a week. So we still do dialysis. Okay, to run, we have to have 3 licenses. Very confusing. I had to check which was which. Commercial vehicle license, CV license, it's for operating within Nova Scotia up to 8 passengers in the vehicle. So basically everything we have on the road right now is on our CV license. We also have a motor carrier license to operate in Nova Scotia. That's for anything over 9 passengers, which we don't have at the moment. And because we are so close to the border, we're kind of unique. We have an extra provincial license for going into New Brunswick, and we can actually go into PEI. Those are all through the UARB, and they're very specific, and kind of a common misconception is that, oh, well, why do you have to have 24 hours notice for our bookings? Because there are taxis in the area, we have to have 24 hours bookings. We have to be a pre-book service. It's right on our license. We don't mess with the UARB. They don't, they don't like that. Also, our priorities are wheelchair, low-income, medical appointments. Again, that's run on a license. They're very specific. Again, that's kind of a misconception. We can take everybody, but they are supposed to sort of fit in those categories as much as possible, which we do obviously try to do because we want to keep our license, because without it we can't operate. CCTS is a member of the Rural Transportation Association. That's our provincial body. There are now 23 providers, and we cover 98% of the province. That excludes HRM and Cape Breton Regional Municipality, who have their own transit systems. The last one to get going was SmartGo, which started in September of last year in Sherbrooke County, and the oldest one is Transport Declare, which has been launched in '96 in Digby. So rural transportation is not a new thing. It's just becoming more common. Like I said, we now got 98%, 98% of the province covered. So, it's come a long way just in the last few years, with more organizations basically covering the whole province here. Right now, our fare structure is based on, unless you're within the Amherst area with that 10 kilometers, we're a kilometer rate. So anything in Amherst is $15 return. Obviously, you're just one way, it's $7.50. So for 1 passenger, it's 75 cents a kilometer. For 2, it's 55. For 3, it's 42 cents a kilometer. That rate starts from the hospital, which is sort of our home depot, where the vans are usually kept, to the location, take the client to where they're going, and then back to the hospital. That's your sort of return route for that rate. We didn't used to charge wait times, but we're having so many trips to Halifax, and your Halifax trip isn't always an hour. Sometimes it's 3, 4. Your driver's down there, your van's down there. So unfortunately, we did start having to charge wait times. The first hour is free, and the first attendant travels for free. Normally with a wheelchair client or with a minor, we need an attendant. Obviously, if someone's got to take the wheelchair person into the hospital to their appointment. Wife, neighbor, if it's a senior care facility, it's usually a staff person goes with them. So there's no charge for the first attendant. I've got some pretty graphs for you. These stats are all from January to December of last year, just sort of showing how our ridership is sort of split out. Interesting to see that the biggest section of our riders are actually 19 to 64, 67%. The seniors, 65 and over, is about 32%, and under 19 is only about 5%. We don't do a lot of children transportation, obviously. School buses. A lot of reasons clients travel with us. Again, interesting, this has changed a little bit over the last few years. Right now, the biggest segment that travelers are going to the social enterprise centers. So that would be the Bridge Workshop here in Amherst, GeoVRC in Spring Hill, and Open Sky in Sackville. The next biggest segment is medical transportation. Say a lot of our trips. We were able to tap into a fund starting September of 23 through the Northern Health Zone. They're covering medical transportation in Cumberland, Colchester, Pictou and East Hants, I believe. At least till the end of March. We're not sure what's happening next fiscal year. So that has kept us crazy busy with long distance trips to Halifax, New Glasgow, Truro, Moncton. So that's, I say, that's the second biggest segment is medical. We do transportation to NACC, to CANU, and sometimes we have, we're doing some, we're going to start an after-school program here shortly. I think it's starting from EB Chandler. We're going to be doing something like that here starting in the next month. So we do education, shopping, social. Social is a big segment too, and that includes the seniors going to the adult day programs here in Amherst and also in Oxford. I think we're now doing that 4 days a week. And again, social events, taking people in wheelchairs to Tim Hortons for a coffee, taking people to church, to school, graduation, and so on. We took someone home on Christmas Day for a dinner with family. A driver, volunteered to do that. So that's why we're taking people. Since 2002, we've been keeping stats for the province on disability. Interesting to see that wheelchairs and scooters aren't actually the biggest segment. Again, the biggest segment is we have a lot of clients with walkers and canes. That's making up, try and think percentage, 25%. The special needs clients, developmental is 37%, and then the rest is sort of broken out, dexterity, pain, mental health. Interesting, Mr. Ellis saying, we do take clients for mental health appointments. We take a client regularly that is trying to recover from addiction. We do quite a bit of that transportation. And again, we're taking seniors to the adult day programs. That is mostly they have like dementia and so on. So we're covering a lot of different disabilities, not just wheelchairs and scooters. Next one is where we're picking them up. The biggest percentage is actually within the Amherst area. It's around 64%. Pugwash and Spring Hill tie pretty much just under 6%. Macan River Hibbert Joggins area is just under 5%. Sackville, we're picking up people in Sackville, taking them into Moncton, and also bring them here into Amherst for medical appointments and services. And then there's about 5% Leicester, Shinnemacass, and Parsborough Advocate. We're not down there a whole lot. It's only about 0.5%. And then dropping them off again, Amherst is actually the biggest. About half of the clients are either coming into Amherst from around the county, they're already in Amherst. Spring Hill's the next biggest one, 16.5%. Moncton, I say we do Moncton dialysis trips 6 days a week, just under 15%. We're taking clients to Oxford, Sackville, Orlac, Halifax, Dartmouth. That's jumped up about 1.5% the last few years, mostly because we're having a lot of long distance trips for health reasons, taking people down at 4 o'clock in the morning. The remaining percent are going to like New Glasgow, Truro, Kentville areas around, so that we take them around the province as well. So out of last year, we had 8,237 client trips. 77% of those were within Cumberland County. They were either in Amherst, going to other areas of the county, or coming in to the county. The other 20% were going to southern New Brunswick, Sackville, Moncton, Dieppe areas. And then the other 3% were going to, say, to other parts of the province, Truro, New Glasgow, Dartmouth. We had a lot more transportation to New Glasgow last year with bone density clinics and so on. The next ones I'm not going to touch on a whole lot. You've got your information. You can read it more in depth. Our fares have actually gone up in the last few years. We're around 40% our fares revenue there now. The province is still a big component of our operating stats. We have operating funding from them. We had a one-time grant the end of the 23-24 fiscal year. And we also have fare assistance funding for them so that we can offer reduced trips, which we tend to use mostly for seniors because they don't sort of fit near the other pot of money. So if they want to go to Halifax, we can help them fund the trip to get to Halifax. I say right now, Northern Zone Health are covering that to the end of March, but we don't know if that funding is going to continue April 1st. They may be capping it. They may totally take it away. We're not sure. So those other pots of money certainly come in to help us get these clients to where they need to go. And then you've got in other things like HST rebates. You guys have been giving us money, and we hope we'll continue to do so. Donations, we do fuel rebates. Those are smaller percentages, and if we sell our older vehicles, we sold 3 vehicles last year. And actually interesting, one of our other sister organizations bought one of our vehicles last year. They were just starting up, the one in St. Mary's, so they bought one of our vehicles, and we sold one to Fire and Rescue in West Hants, I think it was. Their other big vehicle went down to Fire and Rescue in West Hants. So, or we sell them to clients. We don't, we don't scrap them. We try and, sell them where they're going to get used. I think it was West Hants, yeah. Admin expenses make up about 33% of our total expenses. Obviously, the biggest chunk of that is salaries, office supplies, phone, rent, insurance, accounting fees, workers' comp, staff expenses. We reimburse drivers for cell phones, meals when they're on the road, long distance trips. Yes, they're going to get paid for their meals and so on. If the MAC pass doesn't work, they get paid for the tolls and everything. Basically, vehicle expenses, again, mostly the largest chunk is the driver's salaries. Fuel has actually gone down with using the hybrid vehicles. Fuel's gone down about 30%, which is nice to see. And also repairs have gone down because with your hybrid vehicles, you don't have as many repairs. We've had them will be 2 years this summer. And like I said, the 25 to 30% reduction in the fuel, which is great to see in the repairs. We're hoping that that'll continue. Obviously, you've got registration, insurance is a big one. Annual fire extinguisher checks, decals on new vans, stuff like that. We've got a great long list of where we take people. Like I say, mostly that's medical on there, but we do take them to church, to the grocery store, get the haircut, wherever they want to go. The demand is increasing. The plan going forward this year, we're replacing the gas vehicles. We're hoping to get another hybrid vehicle this year. We're in the process of doing actually a federal application for funding the RTSF again. This came out, I think, 2 years ago. So we're applying for that. And we're going to be getting another hybrid Sienna as well to replace one of the 2 aging Dodge Caravans. Those Dodge Caravans are only 2020s, and they've got 300,000 on them, I think it is. We rack up the kilometers pretty quickly driving around Cumberland County. And we are also looking to get a bigger vehicle again, hoping to get a 12-passenger 2-wheelchair bus, which is sort of looks like the one on the bottom of the slide. It won't be that color, but anyway. The next slide shows sort of the layout of the bus. This one is really unique because it has a ramp as opposed to like a hydraulic lift, which would be ideal for us because we have a lot of clients with walkers and canes, and a lot of them that just can't manage to physically do a step. So the ramp would be awesome. It would make loading easier You load your wheelchairs in, everybody else can go sit further back and whatever. It's kind of unique. It's also kind of expensive, but anyway. So that is sort of what we're looking to get. Also with, and actually Jennifer will know this, we met at Pugwash when we were doing the accessibility committee meetings in November, and they are way ahead of the game than most of us with this remedy of all these facilities closing around the province. So we need to start looking ahead as to how we're going to accommodate that, because right now we have basically smaller vehicles, so we need a bigger vehicle. We have some gaps in our day, so if we're taking people to Oxford to the VON programs, we're coming back empty. While we can bring people in to Amherst or wherever, shopping, to go to services, whatever they want, and then take them back 3 or 4 hours later. We've got some gaps that we want to start filling in, so we're not running deadhead, which is obviously we're running empty. And I say to kind of fill the need of these people moving out into communities. Do they need to go to the bridge every day? Do they want to go to Sobeys once a week? Where do they want to go? Fill in that, fill that need for them. I say Sunset is one. Jennifer would know the number, but Oxford has 2 homes. We're trying to look ahead to that,
Right.
being able to service that. That's our information. We have a Facebook page. It doesn't get posted on unless it's a snow day, but we do have one. We have a website as our contact information. That's Peter's cell phone. We have a couple of emails from myself and also our dispatcher. It's interesting that we get bookings via our website that's run actually through the provincial organization. We actually get email bookings now that we never used to, so technology is finally catching up with us.
Good stuff. Very
Which
good.
is great.
Awesome.
So that's basically it. We want to thank you for our continued support. We wouldn't be able to operate without you as a partner. I mean, the province obviously and the federal government, and United Way, all of you, we wouldn't be able to operate without your assistance.
Absolutely.
And we appreciate it, and we hope you'll continue to give it to us.
Thank you very much, and thank you for the presentation and all the information. I'll ask council first if they have any comments or questions. Deputy Mayor Gould, followed by Councillor Strong. Go ahead.
Thank you, Your Worship. Thank you very much for the presentation, and thank you for the great work that you're doing. It's certainly vital to many people in Cumberland County. Just had one quick question is on the pickup location. So the biggest area there was near 65%, but it's Amherst, Tidnish. Just kind of curious from a line standpoint, would majority of them be in the Amherst
Yes.
limits?
Yeah.
So
Yes, no, majority are within Amherst limits there. I say the other percentage, a lot of people are coming into Amherst, probably half of that, 75% or 77%, whatever, are in Amherst, and they're,
Right.
accessing programs, let's say, going from Amherst to Oxford or to Spring Hill. But yeah, Amherst is good, and it always has been. The percentages have gone down a little bit. It used to be, I think, as high as 70, but it is the biggest chunk of people are sort of within the Amherst area.
And thank you again for the service that you're providing to people in Cumberland County. Thank you.
Okay, Councillor Strong.
You remember me, Helen, but you and I have worked together, and I would just like to say how wonderful it was to partner with you. A few years ago, I had a mock disaster at Chignecto Manor in
Yes,
Advocate.
right.
And it went
That was a
very
few
well.
years ago.
That was a few years ago, but even from that experience, even back then, it was amazing. And they were very, very kind to come to Advocate, take our residents to Parsbro while we were for the mock disaster, and bring them back
Right, yes.
all on the same day. And and they enjoyed it. The residents had a great time, and we appreciate that. And it was a great experience working with you.
Thank you.
Good, great, thank you. Anyone, Councillor O'Telling, go ahead.
Thank you, Your Worship. And I just want to say thank you also, and I do very much appreciate you thinking ahead in terms of the remedy and the Sunset community, because it is going to be very demanding on the transportation sector when residents move into community. So we are in the Sunset community trying to look at that as well, but we can't do all of the things, and it's really nice to hear that that's on your radar. So.
Well, it's when I met with Stephanie in July, it's honestly, it scared the crap out of me. When she said, oh, have you heard of the remedy? And I'm like, well, that sort of sounds familiar, because we hadn't had any information. And I was like, okay, all these people are moving from these facilities, and we don't know where. Well, I mean, Sunset you guys are building right across the road there, which is awesome, but I mean, Oxford and so on, like, well, how are they going to get to, you know, what if they want to go to the bridge or to GOVSC or whatever, I mean, or shopping or the library or anything, because I mean, right now, the staff do a lot of the transportation at Sunset. And it still scares me as it's, you know, because this is all happening over the next couple of years as well. It's not like it's going to 10 years down the road. It's like, well, it's happening now, I mean, but, so yeah, we have to be ready. And I mean, with us, we have to, like, I got a quote on a bus yesterday, which I might not get for 12 to 14 months. So we're considering, well, maybe we get a used one in the meantime, because, you know, we could be doing this kind of service now. I say we have gaps in the schedule, and, you know, we could be offering some of this kind of a fixed route. I don't want to go as far as say a fixed route, but there are gaps. We're daily doing the Pugwash, Spring Hill, Oxford. We're doing that sort of golden triangle, whatever you want to call it. So why don't we, you know, kind of put a bus in there and say, okay, well, we're going to be in Oxford at 10 o'clock Wednesday and Friday. Would you like to go shopping for 3 hours? You know, or go whatever. And yeah, we've got to look ahead to that, because with our funding, we can usually only apply twice a year for vehicles. And I say with this federal, it's only this year. Who knows? Next year, it's been around the last couple of years, but last year we weren't approved, so it's a little hit and miss. So yeah, we've got to kind of think ahead quite a bit.
Awesome, thank you very much. Anyone else? Councillor Lee? Go ahead.
Thank you, Your Worship. I'll just be quick in respect of time. I'm just curious about the access for food deliveries. Was there the gap there? Your numbers dropped off significantly.
Yeah, well, that's basically, we were doing it during COVID, along with the dialysis. That's sort of what kept us running during COVID. Unfortunately, since, and then we don't have our bigger vehicles, we haven't been able to fit it back in. I'd like to get to do it again, but yeah, it's something we haven't been able to do for the last couple of years.
Perfect, thank you for the clarification.
Hopefully again in the future.
Yeah, and I agree too, Councillor Telling, and I was recently on the board at Sunset also, and very wary and leery of what the impacts of the remedy will have on your organization going forward. You know, I suspect that it will be a game changer in a lot of respects, you know, so hopefully you're able to manage that. It's just another, I don't want to say, I don't know what the word would be, not fallout, but the unintended consequence of the remedy is, how do you deal with transportation issues? How do you deal with funding? How do you deal with the whole housing? There's a number of moving parts in the remedy that we're wrestling with as we go forward. So anyway, but the other side of it is we're all in this together. So anyway, so thank you very much. Really appreciate you coming to council and giving us all this information today, and hopefully we'll see you again soon.
You can see how much we need help.
Thank you very much.
Yeah, thank you very much.
Item 2.2.3, Cumberland Chamber of Commerce. Come forward and relax, have a seat, and introduce yourselves, and we'll get started.
Keith Thompson, I'm president of the Cumberland Chamber of Commerce. This is Beth Peterkin, she's our PD or general manager. She does all the work involved with the chamber. And so she's going to give a little presentation about what the chamber is all about and what some of the functions that they do. And so Beth, take it away.
Thank you.
Perfect. Thank you very much.
Thank you, Your Worship, and members of council, staff that are here. It's very important for us as the chamber to communicate what we're doing, what we're about, and open lines of communication. I think it's been a while since the chamber has addressed this council, and there are a number of new folks at the table since the last time around, so it's very good to be here. Can I advance the slides here? Go ahead. Thank you. So there's the mission statement up on the screen: to unite business and professional communities within Cumberland County and to represent our members in order to promote more positive economic growth. You'll notice there's an open sign there. We're open for business in Cumberland County. Thank you. For the organizational structure, a lot of people say, oh, are you, under the Canada Corporations Act? We're actually registered as a not-for-profit under the Board of Trade Act Part 2. and we're not permitted to be a charity. So it's a little bit different. I'm always filling out application forms for things, and they're wanting our business registration number, but boards of trade and chambers of commerce are registered quite differently from other nonprofits. We have a volunteer board of directors. Keith, as he mentioned, is our president and chair, and I'm a part-time employee. I work 24 hours a week. And you'll see there, we were registered, the Amherstton Area Chamber of Commerce was registered originally in 1994, and over the past 4 or 5 years, we've been working with other chambers and boards of trade within Cumberland County to amalgamate under the name of Cumberland Chamber of Commerce. That's finally coming to fruition. The last piece of documentation is on its way into Industry Canada. It's not easy to, the Board of Trade Act is very different from anything else I've dealt with, but we have to provide a legal description of what our geographic area is, Cumberland County, and I'm getting quite creative to describe that because apparently it doesn't exist in the province or in the municipality what the actual boundaries of Cumberland County are. So that's going in. And the last Board of Trade to dissolve and come under our umbrella was the Parsbro Board of Trade, and that happened a few months ago, and they have filed their paperwork to dissolve, so we are now filing our paperwork to officially become the Cumberland Chamber of Commerce. Legally, we're still known as the Amherstton area, but we're operating under the name of Cumberland Chamber of Commerce. Okay? So board representation, it's very important to our board that we represent all of Cumberland County. And that was something when we were in negotiations with the other chambers and boards of trade, they were afraid it was going to become very Amherst-centric, and we were adamant that it was going to be representing all of Cumberland County. So as board members' terms come up for renewal, initially the board was pretty well all Amherst, but as board members come up for renewal, their terms end, we're taking an active role in recruiting new board members from throughout Cumberland County. So you can see there the list of our current board members. We have 10 currently on the board, with quite a wide representation throughout Cumberland County. There's 2 vacancies on the board right now, and our AGM will be coming up probably at the end of May. So we're looking at recruiting other folks from outside of Amherst to fill those spots. It's a gradual turnover, but I think we've done a good job, and it's important to represent all parts of the county. Okay? So collaborations. I'm a part-time employee. The board is all volunteers, so we can't do this without collaborating with all kinds of groups. Team Cumberland is a group that is quite unique in Nova Scotia, and we've been told this over and over again by the province. Team Cumberland meets once a month. We have anywhere from 12 to 18 people at the table. The municipality is represented, as well as the town of Amherst and Oxford. The Business Connector, the CBDC, I'm going to forget people. Glenn comes from the community of Cumberland here. Ignite Atlantic, Invest Nova Scotia, ACOA, Immigration, all sorts of organizations that work within the business development community meet once a month. And the purpose of the meeting is to share what we're all doing so we can support what we're all doing. And I may hear somebody from Invest Nova Scotia say, oh, we have this new program that's really advocating for people that want to export to wherever, Europe. And I can take that back then to our membership and pass on that information. So it's a really good way to exchange information. We get through the meeting in about an hour to an hour and a half. Everybody has a chance to report on what they're doing and ask questions, and it's a really good sharing. Cumberland County Community Health Boards have also participated and collaborated with us quite a lot. Mind Your Business is another organization, group of individuals, group of organizations that meet once a month, and that's the Business Connector, CBDC, the Chamber, and the municipalities. And a lot of what we do is design workshops for the business community. So rather than me setting up workshops and Amherst setting up workshops and somebody else setting up workshops, we do it together collectively and then market them collectively. So, and they are held throughout the county in different places at different times. We take great pride in reaching out beyond, not everything is Amherst-centric for sure. And we're also members of the Atlantic Chamber and the Canadian Chamber of Commerce. and that provides us excellent resources. I get lots of emails from them, opportunities to attend Zoom meetings and workshops. So it's a learning curve for us, as well as sharing experiences back and forth and learning from what they're doing. Advocacy is a huge part of what chambers of commerce do, and being a very small chamber, our hands are quite tied in what we can do, but by being part of the Atlantic and the Canadian Chamber, we can add our voice to theirs. So we often are writing letters to support things that they're advocating for at the provincial or the federal level. Okay. So I've just listed a few of our programs and events from the past year. We have done breakfast with elected officials, so Your Worship, your turn will be coming up again.
Look forward to it.
The last breakfast was with Mayor Scott, and again, you can see we've held them in Parsboro, Spring Hill, and Amherst, so spreading things around the county. This fall was particularly busy with both a municipal election and a provincial election, and we held all candidates meetings for both of those. We had a total of 7 all candidates meetings for the provincial and 7 for the municipal, 2 for provincial, and that was all within about a 4-week span. So that was a lot of extra meetings that happened, usually weekends or evenings. But it was an opportunity to provide the residents of Cumberland County to be able to get out and meet the candidates that were running. Our annual general meeting last year in May was held in Parsboro, so this year it will be held in a location other than Parsboro. And the Small Business Awards Gala, we do this every year during Small Business Week. And last year it was held at the Northumberland Links Golf Course. So again, it will be held somewhere different this coming year. Okay. So just a couple of photos. The one at the top of the page was the breakfast with Mayor Scott, and that was held in one of the restaurants in Parsboro. And the larger picture at the bottom was our annual general meeting held last year, and we had about 75 people out to an AGM. And you know, oftentimes you see an AGM, you've got your board of directors and maybe 2 other people. So we were happy to have 75 people there, and we had some opportunities for people to have display tables. We have some of the local businesses talk about their experiences, how they started and how they grew, and it was generally considered to be a pretty good success rate. Okay. So the Business Awards Gala was really the highlight of the year. It was held at the Northumberland Links, as I say, and that was a phenomenal facility. They were so easy to deal with, very receptive to everything we needed. It was one of the biggest events they'd ever held. You can see some representative photos there, and thank you to your Cumberland County for sponsoring the award for the service in an organization providing excellent service to Cumberland County. And you can see the presentation there to David Forbes from the Parsboro Band Association. And also you had a runner-up presentation to the folks at GOVRC in Spring Hill. And you can see that picture down on the bottom right-hand corner. So there, we have a huge number of pictures. I could probably spend an hour showing you pictures. But it was 107 people at that event, which in previous years, there's been 60 to 65 people at the Business Gala. So I think the fact that we are now Cumberland County is giving us a bigger impact and drawing more members to the organization. We've had quite a few organizations and businesses that have joined the chamber as a result of that gala. So, okay. So I mentioned advocacy earlier. The U.S. tariff issue is taking a lot of time right now. As you know, things change daily, weekly, monthly, hourly. A week ago, Premier Houston held a meeting in Halifax and invited the executive directors of all the chambers of commerce to come, which was a phenomenal opportunity to meet with him and express what we're hearing from our membership. He followed that up with a survey that he sent to us for us to send to all our members. And so all of the chambers sent the survey out, and apparently they had over 150 responses from businesses in Nova Scotia around the U.S. tariff issue and around the issue of reducing interprovincial barriers to trade. So that's a way that we can advocate for our businesses to get their voice right to the leaders. The Chignecto Isthmus, which has already been mentioned tonight, that's been on our plate for a number of years. We've sat on a number of committee meetings, written letters of support, expressing an opinion, monitoring the traffic that comes over that isthmus every year, and how if we became an island, how many millions of dollars we'd lose, on a monthly basis here in Nova Scotia. Green energy projects are huge. I was very pleased to participate on the Cumberland's, the SEEP committee with Glenn and the consultants. We've also written letters of support and attended meetings on some of the wind projects that are going on in Cumberland County, and encouraging our members to take an active interest as well. Fire halls and libraries are huge things that have lots of, we were talking before the meeting started about some of the issues that come up and the responses from various communities. So we're very supportive of things like fire halls and libraries and some of the good work that you folks are doing. I know I was a municipal councillor when I lived in Ontario, so I don't envy you on that topic and trying to deal with those kinds of things. And of course, tourism and economic development is a huge piece of our advocacy. Supporting, I mean, even if the business is not a tourism business, often they receive economic benefits from the tourists coming here. Like a gas station, it wouldn't necessarily be a tourism business, but the tourists need to put gas in their car. So we support all of those kinds of things. Okay, fine. So there's our contact information. We have an office at the Cubic Building in Amherst that's been there when it was originally the Amherst Area Chamber. And the beauty of being in that building, number one, the rent is very inexpensive and it includes all the utilities, but we're also cohabiting with the Business Connector and the CBDC. So it's a really good way to keep in touch because we're all 5 or 6 offices in one building. Our mailing address is in Amherst. We've been using an office in the Sunflower Building in Main Street in Parsboro, which has been a good place for people down in that part of the county to drop in. I also wanted to, I've left these cards on all of your desks tonight. This is our major event that's coming up in April. And we're working with the Sunset Community, which has also been mentioned earlier this evening. And it's all about encouraging businesses to consider hiring people with disabilities and the benefits for hiring people with disabilities. Our keynote speaker, Mark Wafer, is coming to us from Ontario. He owned 25 Tim Hortons in the Toronto area, and he's deaf. He's been deaf since birth. So a very successful businessman, hired over 250 people with disabilities over the period of time that he owned those Tim Hortons, and he is going to speak and tell us how no lost time, people show up on time for work. They don't want to take vacation. They want to be there. They're never whining. They wear their uniforms. It's just the whole benefits of hiring people with disabilities and the supports that are available here in Nova Scotia for mentoring people with disabilities as they get into a new career opportunity. So we have book space. We have space for 170 people at this conference. It's a one-day conference. We're almost sold out, which is exciting. We have provincial representatives, federal, municipal representatives, people with disabilities, families with disabilities, nonprofits that work with disabilities, businesses that don't hire anybody right yet with disabilities but are interested in knowing more. So if you've thought about it and haven't done anything about it, I suspect by the end of next week we'll be sold out. So the contact information to buy a ticket is online on the brochure. It's at Eventbrite. And certainly we'd be happy to answer any questions that any of you have.
Great, thank you very much. Great presentation. I'll go to members of council first. Does anyone have any questions or comments? Oh, they've gone silent on me all of a sudden. I have a couple. One is that I look at your list of things that you're working on, and I'm not sure if you took our list or we stole yours. They're very similar, I have to say. So the other thing is too is I had the opportunity back in the fall to go to the awards gala at Northumberland Links, and I will say that was my first official duty, was to go to that. Yes, it was, and a couple of things came out of that. It was a phenomenal event and extremely well run, so kudos to you for that. The other thing was to watch the different parts of the county and different groups and different businesses and all of that. And I always use the little thing, tie knots. And, so, Parsboro people were tying knots with Spring Hill people, were tying knots with Pugwash people and whatever, and, making connections. And, and that's so important to the fabric of the county and what goes on a day-to-day basis, and the role that you guys play in pushing that agenda forward. Having been previously on the Chamber of Commerce Board, Prior to being elected in 2020, I firsthand saw the great work that you guys do and all the advocacy that you do on our behalf, and we certainly appreciate it. So thank you very much for your presentation today.
Thank you.
And
Just make
Mr.
a
Thompson.
closing comment. The bulk of our funding comes from memberships, and we are struggling a bit with money and with memberships. So I just want to encourage everybody here to tell their friends, neighbors, business associates that the chamber is open for membership. There's different categories of membership, and we would welcome as many new members as possible.
Good. Well, thank you very much, and we'll do what we can to help you out. So, thank you.
Thank you.
Thank you. Have a good evening.
You too. Thank you very much. Next up, item 2.2.4, Oxford Community Center Association. We have some presenters coming forward. Come ahead. Go ahead, gentlemen. Introduce yourselves.
Sure. Good afternoon. Thanks for inviting us to make a presentation. My name is David Hoffman. I've been a long-time resident of Oxford, 30 years, and I have a place in Wentworth, so I'm paying taxes in the county. You'll be happy to know. This is Jordan Burkhart. Jordan also lives, well, actually just outside of Oxford, and works at Oxford Frozen Foods, is a senior executive there. And we have our volunteer board behind us. Everybody from the board has made the effort to be here tonight. We've been active for about the last 4 years, and this really came about as a result of the loss of our Lions Community Centre. I think probably everyone knows around about the sinkhole. And so the community has been without a community centre since then. So
Let me stop you just for a second. I
Yeah.
don't like to interrupt, but if you wanted, if you wanted to introduce the members of your board that
Sure.
are here for council's familiarity,
Thank you.
that would
Yes,
be a great
I'd be
thing.
happy to do that.
Thank you.
So in the very back corner, with his hand up, that's Matthew Bragg. So Matthew is part of the Bragg family and works as a senior executive with the Oxford Food Group. And Paul Jones, who is recently retired but has run a business from locally, as you know. Over Crystal McNutt, and Crystal works in Amherst. Troy Miller, who is actually a resident of Amherst, but brings expertise to the group. He's the senior executive engineer at Oxford Frozen Foods and has a lot of experience in managing the construction of large buildings. And then Leda McDermott, who is a local entrepreneur in Oxford, and Connie Pettigrew, who is also a local entrepreneur and financial whiz in Oxford.
Good. Thank you very much, and welcome, everyone.
Yeah, and so if there are questions afterwards, I've got Jordan here to help, and we got some the rest of the team to help too.
Very good.
So okay, good, thank you. So we lost the Lions Centre, and the community is growing. Oxford has been growing, and more and more so recently. So this is, and when I talk about Oxford, we really talk about not the town of Oxford only, but we're talking about the community that forms the kind of the greater Oxford area. So that encompasses a large part of the county, or certainly a part of the county as well. So it's been growing. We've had migration into the town, primarily because of the activities of Oxford Frozen Foods and bringing people in. If you walk down Main Street in Oxford, it's about the most cosmopolitan place in Canada, or certainly in Nova Scotia now. And so there's been immigration. There's from many parts of the world. I'm not sure I could list them all. And we've had some refugees there as well. And I think perhaps you know the story where Oxford Frozen Foods brought the refugees that came into Cumberland County into the town and gave them work, and they were housed there. So the town has responded. There's more housing being built in the town and in the local environment. And frankly, I lived there for 30 years, and I don't remember many houses being built. But the last 3 or 4 years, there's been several dozen anyway. So the town is growing, and it needs a community centre. It's just as simple as that. People have actually moved to Oxford, found that there was no focus or forum for people to get together. They didn't really make the connections they wanted to get embedded in the community, and they moved. And so we need this to try and help people to create a tighter community and to make it more inclusive for people. Thank you. Yeah. Next slide. So we are a registered society. We are a non-profit, and so we have we can take donations and issue charitable receipts. That's quite a challenge, by the way, but we're able to do that. We have very, very clear objectives. This is a group of volunteers. We're leading the community to build this centre and then to operate it on a very low-cost basis. So we will have some staff, but it'll be minimum, and we're going to run this with volunteers. We've had some experience with that, with running of the rink. So it's not going to be exclusively volunteers. I think that's that's going to be unsustainable, but it's going to be a combination of both, and we're going to use volunteers as much as we can to reduce the to keep the running costs down. We've had a lot of community input prior to embarking on the actual construction. We've had meetings, we've had surveys, so we've been able to determine the needs and wishes of the community. I'll say up front that one of the things that the community had, not highest on the list, but were fairly high up, was a swimming pool. We weren't able to incorporate that into the design, but there is an opportunity maybe down the road to add that if that demand still exists and if the funding's available. So we also had a number of visits to other community centres. We came to Spring Hill, we know it anyway, and we went to a number of different community centres around the province, Guysborough, in the city, and down the South Shore. So we saw what other community centres were doing, mostly funded by the local municipality, but a combination of things. And so we saw the facilities, we saw how they were run, saw some of the financial information. So we were able to have a pretty good idea of what was out there, what other people had learnt, and so I think in the designing of what we've done, we've been able to avoid some of the obvious mistakes that other people have found that they made, and I think it's going to work out really well. Next slide, thank you. So this is what we have in the community centre. We have a fitness centre, so it'll have all that, the fitness equipment in it. I will say initially we weren't going to do this because there was a fitness centre in the town of Oxford, and we didn't want to put one of our neighbours out of business. But he decided that he didn't want to continue. We now run that fitness centre, and we're going to move that into the community centre. We're going to put a childcare centre in there. That'll be run by the YMCA. There is a childcare centre or childcare in the school right now, but they need the space. So I'm not going to say they're going to kick them out. I'm not quite sure that that's quite the extreme, but they need the space, and so we don't have any other place in town for a childcare centre. There's a gymnasium, so that'll allow us to have basketball and pickleball and badminton and things like this. It's more and more difficult to get regular time committed in the school facilities, and I think probably everyone knows that. And it doesn't work well for community groups. It's very unfortunate, but we don't have a facility where the community can reliably go to have recreational facilities. So this will provide that. We'll have some multi-purpose meeting space. It'll be two sort of classroom-sized rooms, or it'll be one room with a divider to make it into two. We have a sort of a temporary library accommodation right now in the town. That's going to move in here. There'll be a commercial kitchen which will allow us to have functions there. One of the things we worked hard to have was a walking track, and I think we learnt this at Spring Hill, seeing seeing the upstairs walking track. So we're going to have something similar to that. It'll be a second level over and above the gym, or the gymnasium. So you can walk around, you can see what's happening in the gym, which will make it interesting a little bit. And it'll give people an opportunity to get out, particularly in those months, in the winter months when they otherwise can't. It's funny, I was in Wentworth Rec Centre yesterday, Tuesday, playing pickleball, and before me was a group, and they were just walking around that small area in the Wentworth Centre. That was their recreational facility for them, and it was great to see because it's really not practical. A lot of them were elderly. One of them was 100 years old, going to 101. I thought that was pretty good. He was out there doing his walking. So, but this allows particularly older people to get out and have that recreational facility. And then it's going to be very close, if not actually at net zero. So we're trying to look at it as a sustainable and environmentally friendly facility, and fully accessible as well, by the way. So that's another layer of cost that gets built into this, but also very important. Obviously, we have to do that. And there will be a little bit of business rental space as well, but fairly small amounts. So mostly about recreation, childcare, library. Those are the big takeaways, I think. So if we had known what this was going to cost before we got going on this, we probably never would have started. It's a formidable number. We didn't think it was going to cost this much. It got, as COVID sort of took over and the costs escalated, we didn't increase the size of the building, but the costs just kept on going up and they haven't come down. So the total cost of the project is $24.5 million. As I say, we would never have contemplated trying to raise that sort of money, but it kind of got moved up on us as we moved along. But so far, we have raised $21.5 million towards this, which is mind-boggling for me that we've been able to do that. Anyway, we are a long way along in the right direction. We're $3 million short, and so we're now into our fundraising stage of going to corporations and the community and so on, and we're here today as well. Where's the $21.5 million come from? It's really from three main sources. We've had a $7 million commitment from the federal government, $7 million from the province, which we have actually received, and a large amount, so I think it's around $5.5 from the River Phillip Foundation, which is the Bragg Family Foundation. An incredible donation to the local community for them. And then there's been some other bits and pieces, and so we're about $3 million short. I should say as well that the town of Oxford. So the town of Oxford has committed a total of $350,000 towards this as well. Some of that is over time. Some of that is in kind. They effectively donated the land, and some other things. So that's the town of Oxford, and we have, as I say, we have $3 million still to raise. We're very confident we can do this. We're confident enough that we've started. If you've been through the town of Oxford recently, you'll see in the site of the old high school that we've got going. It's not that visible because it's all been foundations, and we're waiting for the steel to be delivered, which is happening this week, we hope, and that we'll start to see some vertical construction starting even as soon as next week. So it is underway. We've got the design fully, it's fully done. We know exactly how it's going to be done. Troy's overseeing the general construction manager people, Bird Construction, and we have a fixed price contract, so we feel good about that. So we're very confident in the $24.5 million that is not going to get away from us. We know how much we have. We know how much we have to raise. So we're getting close. Our ask for you is to match the donation or the contribution from the town. Now, I'm going to just give you a little bit of background. If we just go back to the previous slide, the reason I pitch it at that level, okay, is that this is not the town of Oxford. I just don't want you to think it's purely the town of Oxford. This is for the community that Oxford services. So when you look at the population in the school population, it used to be about 60% county, 40% town. Today, recent numbers from best we have from yesterday, 55% county, 45% town. So that gives you kind of a picture. It's about, let's say it's 50-50, but it's actually leaning a little bit more to the county. The fitness center, so we run the fitness center today, it's about 50-50. The arena, the usage in the arena is about 70% county, 30%, that's right, Jordan, isn't it? 70% county, 30% town. And the seniors club is about the same. So so what we're really looking at is Oxford is obviously servicing its own community, its own citizens, if you like, its own residents, but it's servicing that broader area. And in fact, the services in Oxford are primarily, or more than 50%, servicing the county residents. So look, it's obviously that's an important thing for you when you're considering this, but I just want you to understand those numbers. So when we look at the donation contribution from the town, they've contributed towards the capital costs $350,000. They are also going to help us with waiving municipal taxes for a period of years, and I think it's maybe 20 years. So they continue to support. We're looking at so 350,000. If you want to think about it, I'm going to ask you to think about it this way, which is that this is a $24.5 million project. So for 1.5% of the cost of that project, think about the leverage you're getting for your residents, okay? And that's, so 1.5% of the total capital cost. It's not, so I think we've been able to get this leverage. I think it's to the benefit of the whole community, and we really would like to have your support.
Thank you very much.
Questions?
That's where we're going next. Councillor McCormick, go ahead.
Thank you. Thank you for the presentation, and it's really nice to see something like this coming to Oxford and surrounding areas. And I did see your ask of $350,000, but I have a few questions. What is it going to cost to maintain this facility for a year, and what are your plans to come up with the funding to maintain this property for future years? I see that there is a growth in the community, but is it enough tax base for taxes in order to pay for to run the facility?
So, so we have financial plans put together. We think that it can be self-sustaining based on memberships and user fees. So we would have memberships for the fitness center, and then user fees for the other facilities. We are recognizing that most recreational centers run on funds beyond that. So we are planning to have some events to raise money as well. We don't plan to have to come back to council, but I'm not saying that we wouldn't.
I think, David, too, if you don't mind me
please.
adding to it, just from a business perspective, one of the reasons we have the childcare, we looked at this to try to offset, recreational activities, if you want to call it, or community groups using it. There's not enough funds, so we tried to build what we call more of a business wing within this community center as well. So when you look at the childcare, if you look at the library, you look at the fitness center, these are our big revenue winners. And then some of these other activities will help add to the cost of the building. We also looked, from our numbers, we looked at what the old community center in Oxford had for revenue. We think we can leverage those numbers, but we tried to stay conservative in what we thought we could expect. And yeah, some of this again is keeping costs low. So the pool, well, the operating cost was too high. Although it would have been nice, there's pools in Amherst. It's not a catch-all, just as one example, but we had to make sure we focus on a low-cost operation to make sure we can be sustainable in the long run.
Councilor McCormick?
Thank you, guys.
Yeah, the other thing is the low cost is important. So using volunteers would be one of the ways to do that. The other is to have it at net zero, and so it's we're going to have solar panels and so on. So the operating costs for heating and so on will be low. So.
Councilor Strong, go ahead.
Yes, you said it was going to be fully accessible, and you're having a second level. Is that not counterproductive as far as saving money?
Yeah,
Do you have to use, are you putting in an elevator, or how is that going to look?
No, we wrestled with that one, so one of the things that we added was an elevator.
Okay.
And it's only to go up one floor, but you have to have that, and we decided that if we were going to be accessible, and part of this is just what makes sense, but because there are people who need that help, but also the federal government required this. If we were going to have a walking track upstairs, we had to make it accessible.
Would it have been less expensive to have it on the main, like on the ground floor,
Well,
with the rest of the building?
Well, then you're adding. You're making it bigger. The footprint is bigger, and so we looked at that, and we realized it was easier to go up than to go out.
Thank you.
It's cheaper to go.
Yeah.
Absolutely.
Thank you very much.
Yeah.
Councilor Fromm?
Yes, I was just wondering if first of all, what is the population of Oxford, the town, and have you done a study on like how many people you'll be catching from the county?
I think the last census for Oxford was in the 1,200 range, and I don't have the number for the county. I think it's a little hard to know where that boundary is.
Of course, yeah.
So I think for the easiest way to look at it is probably the school boundary, but that's not exact either, and this will bring people in from beyond as well. So I was talking to people who live in Pugwash, and this is not to take away from what happens in Pugwash, but they're frustrated. They don't have somewhere to go and play pickleball when the school's closed. They're going to come to Oxford. They think this is the best thing. They think it's just great. So it's not a clearly defined boundary.
No, of course, no, thank you.
Good, thank you. Councilor Redmond, go ahead.
Find my button there. I want to commend you on taking this project on. I think this is going to benefit so many, and I can't wait to use the walking trail. Maybe that'll get me off my out walking. I don't think you're going to have. When Angel came on, it reminded me of being on council years ago when they were talking about Spring Hill opening up their community center there, and the nays against it. But look at how well that has done. And I think Oxford can do the same thing with Spring Hill. And again, I really look forward to it, and I commend you all. You have a very good working committee, and thank you.
Thank you.
Thank you. Any other members of council? Councilor Lee, go ahead.
Just quickly, Your Worship, thank you. I think this sounds great. I'm a huge fan of community centers and know the importance of them, and it looks like you have a fantastic board. I'm just curious because I do know the expectation of carrying the load with memberships and things like that. We have a very rural, small community center that we support in our area, and I just wanted to share the huge impact it has on individuals who perhaps may not have the finances to attend these centers.
Yeah.
Yes, so I'm just wondering if you guys have addressed the fact. Yeah, thank you. Okay, I see you're nodding, so I'll let you go ahead.
Yeah. So I think from a, it is a user pay system. We have wrestled if there's exemptions to some of that, but we also have to keep it affordable. We know what the average income in Cumberland County is compared to the province, which is is it 45,000 household income, somewhere's in that. So, this is why it's even more important. Transportation costs to travel to all these other areas to try to find something. We need to find something more central. And Oxford is center of Cumberland County. So David mentioned on the previous comment, we foresee people not only in the catch basement, maybe use the arena today, but the people of all of Cumberland County to use it. We're going to be proud of this building. It's going to be beautiful, and it's a center for everyone. Yeah, that's all I have.
Okay. Councillor Hotelling. Go ahead.
Thank you, Your Worship. I just want to echo how well I think you've done so far in fundraising this much and getting government grants. I know how hard that can be. And I think it'll be fantastic. And being a mother of two teenagers who play sports in Oxford often, and having the opportunity to have more tournaments and things like that there, I think that'll just be fantastic. So well done. Thank you.
Thank you very much. Anyone else have any? Mr. Harrod.
Yeah, thanks very much. Look, I drive by the site a lot, heading to the shore, and every day I drive by and I say to my wife, they haven't asked yet, so I don't know.
You knew we were coming.
So here we are, right? So here we are. Look, congratulations, great, obviously lots of commitment and a great presentation, and be a wonderful facility, I'm sure. And I think you answered just a couple of questions about who will own it, who will run it, and what's the governance look like. So I presume there will be an ongoing board that will run it, and you believe that that's sustainable, and, to Councillor Lee's questions.
Simply yes. So it'll be a volunteer board, and we do have, we'll have board governance. We'll have good board governance. It's a huge amount of trust being put in the board to build this and run it. It may be a different group than is here today. It'll change. I mean, just like the council changes and other boards, it'll change over time, and that's good. It'll create new enthusiasm, renewal. But it'll be a volunteer board, and I know it'll have support, ongoing support from the town, because the residents will support it. So the councillors will have to. And I think, and for Jen, for your group, where you are a neighbour, and who else is a neighbour? When you're going to get lots of pressure from people who use this facility, and in fact the whole county will, who to support it. But I do think it can be self-sustaining, and it's going to create such a sense of community that just doesn't exist there today, that will, I think, fundamentally change the experience of being a resident of the community of Oxford.
Right. Good.
Go ahead. Thank you for that. Obviously, you've a committed group, and I'm sure it'll be a great facility. Just a couple more questions. Mostly they relate to money, obviously, but you've obviously have a business plan. You believe it will be self-sustaining. Have you allowed for reinvestment? Have you allowed for that level of replacement and as you go forward in your business plan? Depreciation.
We really haven't. I would say that when we start, everything will be new.
Yep.
I think there's a recognition that there will be repairs needed, and there'll be renewals down the road. We haven't got that in the plan today. Okay. 24.5 was as far as we could think.
Enough's enough, right?
Beyond that. But I do. I think that the where we would have repairs needed, I mean, we're looking at several years down the road to get started, because everything's going to be new, and that is something that I think the board will have to wrestle with. I appreciate your comments. I think that nobody wants to build something that can't be sustained. Like, we don't want to do that. We want to be able to have something that's manageable for the very long term, and we're building it for the long term. I think that's something we're going to have to wrestle with as we go forward. And like most charitable organizations, funding will always be a challenge. I mean, I think we recognize that.
Yeah, I think on the capital side of it, but from a maintenance on an annual basis, we've looked. Yeah, absolutely. Yeah, and we built some in to our formula, but not enough if you start looking at replacement of roof or so forth.
Yeah, if we needed a new, bike machine, then that's okay. But if we need to replace the floor of the gym, that's going to be quite a bit of money, and that'll be a challenge.
Okay. So related to that, I guess, sort of, kind of, is completion date. When do you think you'll be operating? And then related to that is timing of contribution. And so,
sure. Okay. Thank you. Yeah, no, I wanted
flow
to
requirement, that sort of thing.
Right.
Yeah.
So that's one thing I wanted to make sure I did cover as well. So we are looking at getting the building completed probably very early next year, so 12 months from now, and open for business, let's say sometime maybe within a couple of months of that. So that's our plan right now. And in terms of contributions, we are looking at, obviously, cash now is good, but we're also very prepared to look at sort of a 3-5 year plan to work with, and I think we will be able to bridge that to be able to complete the funding of the building. So I think if you 350,000 in 1 year, I realize is a lot, but if it was spread over 3 or 5 years, then maybe that's something that's much more manageable.
Thank you for that.
Good.
Question, Roger's a question.
If I may,
Go ahead.
sorry. Connie and I were just chatting, sorry to interrupt. And just have something we want to clarify and let Connie explain.
Councillor McCormick asked about the tax base in Oxford. The building, to be clear, is not owned or run by the town of Oxford. No tax dollars from the residents of Oxford will go to maintaining this building. As David and Jordan mentioned, it's going to be, our plan is for it to be sustainable, not to say for any major improvements. We don't do a fundraising for those capital improvements, but it is not coming from the taxpayer dollars in the town of Oxford. It's community, it's the Oxford Community Center, meaning it's the catch basin, as they said. So it's not taxpayer dollars.
Perfect. Thank you very much. Just a couple of comments about that. I know Deputy Mayor Gould and I, being former basketball coaches, certainly can talk to the need of a gym that's not in a school. And that point was very well taken with me this afternoon. It is a much-needed facility, for sure. The other part of it is that, in my experience with some of the community groups and around the country, and especially the Titnish Crossroads Community Association, maybe you're not aware, but they have a brand-new kitchen there that's probably 5 or 7, 10 years old now, that was could have been a commercial kitchen, and they chose not to because of the volunteer hours that would be required to look after that in a small standalone facility like that. But the other thing is interesting to note that we get at least a half a dozen requests a year to rent a commercial kitchen in the County of Cumberland for startup businesses. And I think that this kitchen and this facilities bridges a big gap that's desperately needed in the county. I really do. It's just one of those things that goes on in the food industry, and there's always lots of demand. So I was very glad to hear that that's going to be commercial versus just non-commercial, which is a completely different thing. So hats off to you for doing that. I will also note that any of these facilities, regardless of where they're at, add so tremendously to the well-being of the citizens of our county. And that's, at the end of the day, you know, you can look at the costs, you can talk about all of those parts of it, but it's the unseen things that you cannot put a cost on, which is how is this going to improve the well-being of all of these citizens? And you can't measure it, but you know it's going to be great. You really do. So, thank you to you, folks, to your committee, and a special thank you to the Bragg family for all they've done for the County of Cumberland down through time. We're all well aware of that, and we will take your ask through into our budget deliberations in the next 8 weeks or so, and hopefully we'll be talking again soon. So, thank you very much.
I plan to retire right around the time they need the money, so maybe you could just write them a check when I
We'll take it out of your
There you
retirement
go.
fund then.
Anyway, go ahead, Councillor Strong.
We're looking at our community center as well, and we're having some issues there, and may look down the road to replacing our community center because it's disintegrating, and it's the log building. So I was just wondering if you would be willing to share some of the initial plans and how you started, and if you could let me have that before you go, I would really appreciate it.
Awesome, good. Thank you very much. Muchly appreciated. Nice to see you. I guess that brings us to the conclusion of our agenda. If I could have a motion to adjourn. So moved by Deputy Mayor Gould. We are now adjourned. Thank you very much, folks.